they have come a really long way with this because
Absolutely.
I mean, everyone remembers the toupees and the silly plugs, and
Yep. Yep.
it is remarkable. Out
Yeah.
of curiosity, do you just get it done once, or what, or 20 years later, do you need to do it again, or how does
Well,
that?
I think probably 30 to 40% of our patients will do more than one procedure. A, to add density, and B, maybe to go to another area to cover some, but more commonly, people stop using the medications to support what they have, and they lose more hair over time, and then they're sort of kind of replenishing what's lost. And I tell everybody, and this is for all surgeons, I think, I hope people have the attitude that surgery is the last option. I tell that I'm very transparent. I say surgery may be the right option for you. It certainly is not the only option, and we want to explore what we can medically to support what you have. And if transplant is used as an adjunct to enhance what you have, by all means, let's do that. But that's not the go-to. There are exceptions, right? Someone has a scar or has there's some injury or burns, then transplant's the only way to solve that. But for the most part, men and women that come in, we think of transplant as something in addition to medicine, not instead of.